Next on the panel is Wangari Leonida. She's 24 years and she's very passionate about empowering adolescent girls and young women, and she's Kenyan. She has been doing advocacy in her community on SRHR and HIV prevention for the past 4 years, and she facilitates community dialogues, and she believes in empowering adolescents, girls and young women, and she believes that that should be done continuously to protect them from HIV and violence. She has also worked on Athena's Learn project and the Dreams Innovation project, focused on peer-led education, advocacy, and PrEP amongst adolescent girls and young women. So on my nearest right is a doctor. His name is Eric Banganizi, and he's a public health specialist. He's an international development professional for more than 10 years of experience. That is older than me. He has worked with so many organizations, and currently he's working on a PrEPFA, a USAID-funded project, Improved Services for Vulnerable Populations in Rwanda, and he's the technical lead for DREAMS program implementation in Rwanda. He's passionate about adolescent girls and young women. So yeah, that is the team. So my task today is very simple. I just have to give you a background of the situation of HIV in East Africa. So I thought the PowerPoints would be discouraging to look at all the time. So I'm just going to use my written notes here. So there is my picture, and that is my Twitter handle. If you're tweeting, please tag me. I'm happy to tweet back and everything. I see so many young people in the room. So East and Southern Africa is the region most affected by HIV and home to the largest number of people living with HIV in the world. In 2018, Uganda, Kenya, and Tanzania alone accounted for 171,000 new infections, with an increased vulnerability of adolescent girls and young women. The gender-driven imbalance of basic opportunities like education and employment drives girls to unimaginable decisions and to secure basic needs like food, clothes, and shelter, which in 2018 alone saw 12 million women infected with HIV versus their counterpart males at 7.6 million. Young women aged 15 to 24 years accounted for 25% of new infections, despite making up around just 10% of the entire population. The HIV prevalence among adolescent girls and young women 15 to 24 years in the region is 1.6 compared to that of young men at 66,000. In some countries, the disparity between genders is even greater. The reasons behind this are numerous, and some are really complex for us to understand. There's culture, there's poverty, there's religion and customs that solidify child brides married to men with power and experience. For example, the studies from Uganda found that young married or cohabiting couples that have partners who are 16 years or older are more at risk of acquiring HIV than the ones who are married to those who are 15 years within their age gap. A 2014 UNAIDS assessment on demographic and health survey carried out in the region suggests that young women face higher levels of gender-based violence than men of their same age group. Gender-based violence reduces their bargaining power to negotiate safer sex, seek sexual and reproductive health services, including contraceptives, ART, and have safe work environments. And healthy competition with their male counterparts also limits their chances to stay in school. Although SRHR knowledge in young people has increased, the young women are still less aware of SRHR services and issues within the environment. For example, in Kenya, the knowledge of HIV prevention among young people is relatively 64% of young men, adequate knowledge enough compared to 57% of the young women. Data reported to UNAIDS suggests that 80% of the sexual sexually active adolescent boys and young men, and 30% of their female counterparts had sex with non-married or non-cohabiting partners in the last year. In most countries, very few young people reported using condoms during their sexual encounters with young women, less likely than the young men to report using condoms. We cannot ignore the fact that there is a reluctance in producing SRHR commodities within East African region to increase commodity acceptance, population appropriate, and age-responsive commodities. Yes, so that is the situation in East Africa. Now, I would like to pose a few questions to our panel to explain further to attach pictures and figures to the numbers I've just read out. So the first person would be Barbara Kemigisa, and I would like to ask, as a young woman living with HIV, what does it mean to you when we say living beyond your HIV status? And in your opinion, what do you think needs to be changed?
Thank you very much, Alan. Well, this year, it's the end of me being an HIV activist. Okay, yes, I love why. Yes, I'll still wear the crown, but I have realized, yes, I'm being a young woman living with HIV. That is zeroing me down to being a person living with HIV. I want to be a woman. So, first of all, I feel we have dismantled people. We have dismantled young people. When I look at my background, I was sexually abused at age 6 by my uncles. These were my fathers. They were supposed to protect me. At age 15, I got pregnant in school. What my family did, they terminated the pregnancy at 8 months. And then I had to face rejection by my family. I ended up on the streets of Kampala. I later got pregnant again. And this is when I tested HIV positive. There are so many issues I have dealt with as a young girl. And when you look at the situation today, these issues are recurrent. Today we are creating solution. We are dealing with HIV. But do you know how many other young people, other young women would have loved to be part of this conference, this meeting, but they're not in the HIV world? Because tomorrow they may get HIV positive. And just like me, they could also become HIV activists or advocates. So I feel the next day I can be a victim of fistula. I can be a victim of domestic violence. So I've been working as an activist. I've dealt with different people in the community. And I've looked at how these young women come, these young girls come. They are struggling with how to take care of their own children. I have been a single mother for the past, I just made my wedding anniversary on 28th November to my HIV negative husband. Thank you. But the thing is, I have had to deal with other young people who are dealing with, how do I take care of my child? How do I live positively? Will I ever get married? Is there hope for me? I'm having all these reactions with my treatment. How do I go about it? But because I have gone through all these experiences, I have somehow learned how to deal with each and every situation. I have a 10-year-old girl. The girl I tested positive. She's now 10 years old. If you think I'm brave and bold and I can speak, you need to hear her speak. Because she's changing lives with her story. She's an activist for children's rights and well-being, and she's a musician. So I have decided I'm not going to let out what I missed from my parents be the same for my children. I want them to live a different life. But that has also inspired me to do the same for other young girls and mothers. When a mother brings their child to my house, we are like, don't worry, your child is safe. Because they see my daughter and they believe the same can happen to their children. We started Peel Power Uganda because there was a huge need in the community. We look at so much attention being put at the health facility level. Our health facilities work Monday to Friday from 8 to 5, but life happens every day. A mother is not going to be sexually. I one time had to deal with a woman who came at 1 a.m. in the night, bleeding with her baby at the back. The entire night we were walking from hospital to police. But I was only like 22. I could not deal with such an issue. But that was my role. It came earlier. So I feel we have not looked at women as women. We've decided to look at them according to their issues. Women don't come for activities in the community because they are saying this is for people with HIV. And even us who are HIV positive, we will not go because my neighbor will know that I'm HIV positive. So if we choose to do it like, let's do it general, and we just know we have maybe 20 positive women, we have 15 girls who are teen mothers, we just learn how to deal with each one of them instead of just categorizing them. Today, what can we do differently? Let's look at women as women. Let's stop dismantling them. Let's give them a chance to face what they are facing, but let us be their support. Let them come to us for backup. And as parents, I tell young girls, those who are yet to be mothers, and the boys and the men, you play a key role. I have been a single mother because the man who made me pregnant disappeared. But I tell you, don't bring life to the world if you're not yet ready. If you don't, I don't know how many of us here feel contented with how our parents have raised us. If you got a serious challenge right now, can you run to your father, to your mother, or to your guardian and tell them that, you know what, I've tested positive? Can you? Most of us will not. We will have to look for a stranger to talk to them. Why? There is no relationship. I wouldn't want your child to go through the same situation. The mothers in this room, how do you feel when a stranger calls you that your daughter told me A, B, C, D? I want us to put ourselves in such a situation so that we can know that family, community plays a key role. And unless we go back to grounding family and communities, this whole fight is kind of going to take ages and ages. Thank you very much.
Thank you very much, Kemigisa. And I think one takeaway that I've learned from her sharing is that we all need to play our part so that we do not see gender-based violence, and we reduce on the risk of HIV in our communities for adolescent girls and young women. So I'll go to Leonarda. And the question I would like to pose to you is, what is the importance of including adolescent girls and young women in designing and implementing HIV prevention interventions?
Thank you so much, Alan. Hey guys, I'm Leonida Wangare from Kenya. Okay, I feel like involving adolescent girls in designing new HIV prevention intervention is key, because adolescent girls and young women, I'm speaking on behalf of young women from Kenya in informal background. They are not empowered. They know nothing. If you know nothing, I mean, some of the girls in informal background, they have ideas, very good ideas that can sell, that can bring up very nice and effective HIV response. And also, young women and adolescent girls are being denied chances to attend such meetings. If they are brought on board, it can lead to them being included in decision making. Like, for example, PrEP was the newest HIV prevention, and so many young people were asking that, what if I take PrEP and it has side effects? If 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 maybe the adolescent girls were given a chance to to bring out their ideas on which is the best method for them, which is suitable for their bodies, their health, it can bring at least nice and very successful impact in the community. Okay, my second point will be how can we involve young women in implementing the HIV prevention interventions. We can create some online surveys, because nowadays you find that so many young women and adolescent girls spend most of their time on internet. If they are given a chance to have an online survey, ask them, what do you feel? Does PrEP works for you? Does condoms works for you? Because most of the young women in my community, they don't have a chance to negotiate for safer sex. Like, you'll find that her partner won't allow it, and it will bring violence. So if the researchers ask the adolescent girls for their opinion, it will be better, because they will come up with something that suits adolescent girls. And also, I'll give an example to where I come from. Most of the community health workers are not young people. They are people from age 40, 30. So you find that when a young woman like me goes to the clinic, the way I'll be treated, it will be different. And when I get a younger person like me, a person who will understand me, who will know what I'm talking about, it will be at least easier for adolescent girls to be able to access health services. And my last point will be, sorry, there are some policies that are being implemented in Kenya that doesn't suit adolescent girls at all. Like, you find nowadays when you're going to public hospitals to seek for health advice, you are being told that you must be tested HIV. It's a must. And maybe you find that you're not in a position to accept. I feel like being tested for HIV, it's my decision. It's not something that somebody needs to tell me it's a must. So most of the youths, when they get sick, they'll have to go to the chemist and pharmacy, which is not a good place to go. For example, if a young woman finds herself pregnant and she's not ready for the child, she can go to the hospital. But instead, you find majority of the young women back in my home, they'll choose to go for a chemist, and you'll find they'll go for abortion, and it will backfire, because they are going for somebody who is not a professional. Yeah, so that is one main cause of HIV transmission in Kenya. Yeah, thank you.
Thank you very much, Leonida. And what I'm taking away from your points is that we should make policies that work for the adolescent girls and young women. And we should also create programs that respond to their needs, that are person-centered. Thank you so much. So the next question goes to Dr. Eric. And the question is, the involvement of adolescent girls and young women can tremendously reduce the rates of HIV infections. So what skills do we need to give the adolescent girls and young women in rural communities to uphold this? Thank you.
Thank you so much. Good afternoon. The only man on the panel. And speaking about adolescent girls. Thank you so much for this opportunity. For the last, as she said, 10 years I have been working in the health, public health domain. But the one I liked the most was dreams. As the first presenters present in the morning, dreams stand for determined. Who remembers? Resilient? Empowered? And safe. That's all we need that's all the skills we need to give to girls, actually, if I can summarize that in those terms. Girl, when you deal with adolescent girls and young women, what the most important thing they need is life skills. How do they behave when they are faced with a challenge? That's the most thing we need the skill we need to give to them. They need to have self-esteem. They need to know themselves, self-awareness. They need self-confidence. They need negotiation skills, so that when a man comes in, they're talking about blessers. When a blesser comes in, she knows, if I'm going to be blessed, what's next? What after this blessing? That's what we need to teach them. You are faced with a challenge, then you don't have that phone, and you need it. That's what we need to understand. They need those things that the blessers are bringing. That's the challenge we have as adult people, that we think that adolescents don't need the things that the blessers are bringing in. They need them. So how to accept those things? They need to know, if I accept this phone, it's at this cost. Am I ready for this to give out this cost? If not, what do I do in this situation? That's what we are doing with Dreams here in Rwanda. And we are finding interesting stories about this one, about educating adolescents on these stories. First, they need to know themselves. How are they? Their body are biologically made, if I can use that term. How are they? What is the changes that they are facing? Then, what are the life skills they need to have, so that they can face the challenge of their life? And afterward, you need to give them the livelihood. If someone has what she needs, she's less tempted to go to seek for the things she doesn't have, because she will be able to buy them. She's less tempted. But even those who have those things, they might need sex. And other people don't really say adolescents need sex. They do. That's why they are girls, they are boys, they are like adult people. So they need to be able to be equipped well, so that they can negotiate safer sex. Another thing we need to teach them is how to relate with parents. Sometimes when a blesser wants to go around with an adolescent girl, he will use tricks to trick the adolescent to have sex with her. If that girl has a good relationship with her mother, her father, she will go back and say, I'm facing this and this. But if there is no relationship between the parents and the adolescent girls, that conversation will not happen. So we need to teach them how to relate with the parents, but not to forget to teach the parents how to relate with the adolescent girls. I think that's mainly that's all I could say. They need to have life skills. They need to know how to say no and yes as well, because they not always say no. That's for sure. No one will always say no. And if you don't teach her when to say yes and how to say yes, in which circumstances, and mainly to know the consequences of her acts, that will be a challenge. Thank you.
Thank you so much, Dr. Eric. And I'm taking away that we need to encourage self-esteem and self-awareness for the adolescent girls and young women. And we need to impart negotiation and life skills in general to them. So I'm going to come back to you, the audience. And we are talking about adolescent girls and young women. Any questions, compliments, anything you want to say?
Hello, I'm Maria Jani Nambuse from Uganda, Mujo Research Collaboration. I work with adolescent girls and young women. I would like to ask, how easy has it been for you to get in touch with adolescents below 18 years who are at high risk and have not disclosed to their parents, and you're trying to help them, but for example in Muju, when we help them join to get prevention services, their parents need to consent. How have you dealt with that to get the parents to accept that their children are sexually active and to help them to consent? Yeah, thank you. Maybe
Doctor and Leonida.
Thank you so much for the question. That's something that is challenging all over the world of the issue of the consent of the parents. We are lucky in Rwanda. Our government is a progressive government, so we don't really have those kind of issues, even though we do have some. But the government is really knows that that's a challenge. For us, we have lowered the age of consent for HIV testing to 12. So that's very easy for us. And what we do in our community, we are a small country, as you can see. You can go from one end to the other end in 6 hours or 8 hours. So whatever is said in one corner, it's understood in the other corner. So it's then what we do, we go to the parents for those who are below 10. When you are selecting them, actually we select those who are really vulnerable using our rostering. Then when after having them, we go to the parents. We explain to the parents. The most challenging thing in a health field for Africans is that, if I can, let me use the term modern doctors. Modern doctors or modern health professionals think that if they explain it to the villagers, they will not understand what they are explaining to them. That's wrong. You have to find ways to explain to them. I'm called Eric. It's not a Kinyarwanda name, but many people know how to pronounce it because that's how I read to them. So if I go to someone, I tell him or her, HIV is like this and this. Maybe she will not catch 100%, but at least she should catch 30%. The next day when I will go there, she will catch another 30%. It becomes how much? 60%. If you go to there like the first time, it will be like 100%. So it's like you keep talking to them. Don't get tired. Keep talking to the parents. They will know that their children are at risk. Thank you.
Okay. In Kenya, like for example, I work with Athena. What we do as Athena, we work with young mobilizers who are able to go to door, talk to each parent, but mostly we insist that parents should come with their child. There was this time that we were doing door-to-door testing, and we pinched a tent outside. There was this, I would say, kid who came to be tested, and I gave the kid a consent form to go and take to the parent, but instead he went and gave his friend to sign for him. And when I tested the kid, too bad it turned out to be positive. And I asked the kid, who signed for you the consent, before I disclosed the status to him. And I was like serious, who signed the consent? The kid told me that it was his friend. So it brought so much issues, and so after that issues, we do insist that if you are coming for HIV testing, please come with your parent. Yeah.
Thank you so much. I would also want to add, because I know the age of consent in Uganda is 12 as well, but that is just for testing. So I think we should also look into our policies and challenge the parents with our policies that we have. Yeah, so can I have another question?